Hello, I'm George Nero, Chair of Pathology at UAB. Welcome to our virtual tour. We would like to highlight some of the great facility that we have, and more importantly, introduce members of our great team of almost 100 faculty and over 50 trainees. At UAB, we strongly believe in the value of our training program in shaping the next generation of pathologists in the US. An integral part of our educational environment is emphasizing wellness, diversity, and leadership development. I hope you enjoy the virtual tour and welcome to the great field of pathology.
Welcome to the UAB Gross Room. Here at UAB, we get just over 40,000 surgical specimens a year, which range from small biopsies to large complex specimens. At UAB, you'll see everything you need to make you a great, well-rounded pathologist in the future. Our gross room is spacious with plenty of grossing stations for each resident while they're on their surgical pathology month. We also have some of the best technology in the field right now, including Dragon voice recognition software, Vantage specimen tracking, and also a Faxitron. And if you don't know what a Faxitron is now, you'll know later and you'll thank us.
We also have a time in which we get together every day at 2 o'clock at a consultant conference where different subspecialty experts may show cases to have the opinion of the rest of the group. This is a good opportunity not also for the faculty to get together, but also for fellow that behave like instructor and resident to learn from the pathologists with more experience. The residents also seem to like this opportunity so that they can learn about difficult cases, but also cases that are a good example of characteristic entities.
Hello and welcome to UAB's Autopsy Suite. We have amazing attendings and the best support staff. This is one of our rooms and we have a mirroring room just like this. We also have a room for infectious diseases such as COVID, which is prevalent for these times.
On the UAB autopsy service, we perform anywhere between 300 and 350 autopsy cases per year. So we have cases that are forensic cases, we have adult cases, and we also have perinatal autopsy cases here at UAB.
Annually, the Cytopathology service receives about 15,000 pap smears. Additionally, we receive close to 8,000 non-gynecological specimens to include pulmonary, urine, cerebrospinal fluid, bone, breast, and additionally GI specimens. When a specimen comes to the lab, we begin in the cytopathology processing area. Next, they will go to the screening area to be screened by a cytotechnologist, and then finally to the Signout Room to be screened by a pathologist, fellow, and resident.
This is the Cytopathology Signout Room. All the cases that get screened get put here by the screeners, the non-GYN, the GYN, and the rapid cases get picked up by us, the fellows, and the residents. We preview them, and then all of us sit here and sign them out.
We are involved in sign-out as well as on-site rapid interpretations in the bronchoscopy and endocrinology unit, as well as the thyroid clinic.
Welcome to our frozen room. This is where you'll come with an attending and one of our histotech staff in order to provide intraoperative diagnosis and management guidance to our surgical colleagues.
When our residents rotate in transfusion service, or more informally called blood bank, they spend 4 months working with an amazing number of staff that are specialized. Here we also supply blood products for patients in various disciplines. So one of the advantages, one of the things the residents enjoy the most when they're rotating with us is the interaction with residents in other programs. So for example, surgery residents often need blood products, obstetrics and gynecologists. Many different specialties interact with our residents during this rotation. So UAB Hospital is the only level 1 trauma center in a very large area that encompasses Alabama, but also some neighboring states. So our laboratory, our blood bank, supplies blood products for trauma patients that come from multiple locations.
While you're on your transfusion medicine rotation for 4 months, part of that rotation is going to include therapeutic apheresis, where you're going to be doing procedures such as plasma exchange, red blood cell exchange, leukapheresis, and stem cell collections for our bone marrow transplant patients. This is our stem cell collection facility here. It's on the 15th floor of Jefferson Tower.
In addition to our outstanding anatomic pathology program, UAB also has a wonderful clinical pathology program, especially in the areas of microbiology, molecular pathology, and hematopathology. Currently, we're sitting in our hematopathology Signout Room, where we sign out with our attendings that would include residents and fellows, as well as possible medical students. Behind me, you'll see the multi-headed scope, as well as the screen for additional viewing purposes. We're in the core lab where samples are received, particularly through our tubing system. Once its specimen is received, it is accessioned and placed on a conveyor system where it be sent to its respective areas for processing.
I'm just going to show you around the AP resident room, which is where you'll spend the majority of your time when you're on AP services. And even if you're a medical student or even in a different specialty, we have people rotating in and out all the time. And we're just one big group in here learning together.
Welcome to our CP resident room. This is a space where you'll spend most of your time when you're on your CP rotations. It's broken up so that everyone can have individual space and you can group up according to your rotation. We also share this space with our hematology fellows, and our transfusion fellows are right across the hall. We also have plenty of snacks that the program provides, so you'll never go hungry, and attendings are just down the hall in case you need to ask them for questions.
Thank you for joining us on the virtual tour that highlights key areas of the residency training program. The department is spread out across 4 buildings, and there are 4 sites total in addition to the main hospital. All sites are within walking distance, so residents do not need to worry about parking. There are 6 total resident rooms, a separate room for those who are on call, and an individual office for the AP and the CP chief resident. For more information, such as benefits, specific rotation information, or contact information, visit our website. Thank you again, and go Blazers!